Today I want to talk to you about dry eye, an area that is incredibly impacting and for patients and very important to the practice of optometry. There are between 35 and 38 million Americans that suffer from some form of dry eye, from mild to severe. And there are two basic elements of dry eye because it is multifactorial. There's many factors that can lead to dry eye type symptoms. But if we break it down into just two, the one is organic, and that is the fact that it's aging. And there's also hormones that are involved in the production of tears and the tear components, and testosterone being one. And testosterone, as we age, diminishes. And since women have less testosterone to begin with than men do, that's why we see an outsized number of women that have dry eye issues. It can be inflammatory things like Sjogren's disease, rheumatoid arthritis, and other things that bring inflammation that create dry eye type symptoms that are very debilitating and very irritating. Tear production can be in terms of decreased tear production or evaporation, as some of the various layers of the tears are cut back. The other side of it is environmental. We see that there's a lot of folks that are on the computer today, and 8 hours, 10 hours, 12 hours or more a day. The average person blinks roughly every 4 seconds, so 15 times a minute. After several hours, computer users can tend to start to stare at the screen, and they don't blink as much. And numerous studies indicate it's somewhere between 3 and 9 blinks per minute. And so that drop can cause an evaporative issue with the tear film. And then instead of the eyelid gliding nicely on a layer of tears, now you get an ever so slight amount of friction. And when you blink between 14 and 18,000 times a day, after 4, 5, 6,000 blinks, that can begin to cause some irritation and inflammation. Purpose of tears are to provide optics so that the tear film can, so it makes the eye, despite the high spots and low spots, a good optical lens for us to be able to see. And the other thing is to maintain the health of the ocular surface. There's 3 basic layers to the tear film. You have a mucus layer. And because if you take salt water that you think of in terms of tears and pour that on the back of your hand and then go like this, it's going to dribble right off. With the eyes being vertical, how do we get the tears to adhere to the eye and the ocular surface? Well, you have these little cells called goblet cells, literally thousands of them on the conjunctiva that secrete a real fine mucus that coats the eye, and the tears just adhere to it chemically. And then you have the saltwater brine that's the majority of your tears, that is what we typically think of in terms of tears. But did you know that your tear film is a purified form of blood serum? There's been nearly 1,000 individual proteins that have been discovered that are in tears, and many of which have significant functionality with the eye. There's been a biomarker, a protein biomarker in tears that's been published and that has been patented for breast cancer from tears. And so we know that rheumatoid factors and diabetes and other things can be picked up within the tear film. And that's a very exciting area of study. But then the third layer is you have 40 glands on your lower eyelid, 40 on your upper, called meibomian glands, and they secrete an oil, a very thin oil layer that coats your tears, and it slows the rate at which your tear film evaporates. And one of the, if not the leading cause and contributing factor to dryness, are these glands can begin to clog up and begin to not produce tears as much as they should, or produce the oil as much as they should, thinning the layer. And then patients routinely will report that they have issues first thing in the morning. They have issues with any ceilings or air conditioning fans that, any least bit amount of wind on their eyes, causes a great deal of discomfort. So those are the 3 major tear film layers. And so we want to talk about diagnosis. We use the SPEED questionnaire. There's another one called the Ocular Surface Disease Index, OSDI, that can help us to tease out how much of a problem. We break it down into 4 levels. Level 1 being maybe use tears occasionally as needed, but really don't need them that much. Level 2, okay, it's bothering me a little bit more. And at that point, then we need to get a little bit more programmatic. We need to say, okay, I want you using these drops at least twice a day, just as the replacement tears to fill the tear reservoir of the eye. Level 3 gets to be a lot more issue with inflammation. We'll use moisture chamber goggles, we'll use heat, we'll use expression to get those glands working better, we'll use steroid eye drops and anti-allergies to try to get the tissue to rehabilitate. And level 4, we start talking about using autologous serum and amniotic membrane, living contact lens that, that dissolves, that helps with the limbal stem cells in the eye, or the autologous serum where we take the patient's own blood, centrifuge out the clear serum, and mix it between 30 and 50% with sterile saline and use those as eye drops. That is an absolute fabulous key to being able to help patients. So that in a nutshell is dry eye and what we try to do, how we try to diagnose this, and what some of the major causes are. Thank you.